In professional coding, we often code for radiological supervision and interpretation. And coders are okay when they code it. However, when they start thinking about it, they're second guessing themselves. So I want to have a discussion on what is radiological supervision and interpretation. All right. So at AMCI, we like to simplify things. And essentially, it's when the doctor is the surgeon and the radiologist. Sometimes doctors need radiology, and we call this guided imaging when they're carrying out a surgical procedure, just so they can have that much more precision. All right. So here is the guideline. And the guideline is such. It's a big guideline, and I'll read it for the sake of this discussion. Supervision and interpretation, image guidance. Imaging may be required during performance of certain procedures, or certain imaging procedures may require surgical procedures to access the imaged area. Many services, including image guidance and imaging guidance, is not separately reportable when it is included in the base service. The CPT code set typically defines in descriptors and or guidelines when image guidance is included. When imaging is not included in a surgical procedure or procedure from the medicine section, image guidance codes or codes labeled radiological supervision and interpretation RS&I may be reported for the portion of the service that requires imaging. All imaging guidance codes require one, documentation in the patient's record, and two, description of imaging guidance in the procedure report. All RS&I codes require one, image documentation in the patient's permanent record, and two, a procedure report or separate imaging report that includes written documentation of interpretive findings of information contained in the image and radiologic supervision of the service. The RS&I codes are not applicable to the radiation oncology subsection. All right, so we said a lot, but coders, when you're coding for radiologic supervision and interpretation, in other words, when the doctor is the surgeon and the radiologist, and the doctor needs that imaging to carry out the surgery, then this is how you code it. All right, we got a scenario, and that's how we're going to explain it. Of the following answers, which best describes the encounter? A, 47000, B, 47000, 7692, C, 47000, 26 modifier, 76942, and D, 47000, 76942 with a 26 modifier. Now, if you look at our answers, we see this 26 modifier. A physician performs a percutaneous needle biopsy of the liver using ultrasound guidance. The physician obtains and interprets real-time ultrasound images during the procedure to ensure proper needle placement. These images are saved in the patient's records, and the ultrasound guidance is documented in the procedure report. All right. Of the following answers, which best describes the encounter? Okay, coders. Essentially, you always have to remember when a procedure is carried out with ultrasound guidance and the documentation says that the physician is doing it, the surgeon is operating in two capacities: the surgeon or physician and the radiologist. Just remember that. Now, inventory. Let's go ahead and inventory. This patient had a percutaneous needle biopsy of the liver and ultrasound guidance was carried out. So we know that occurred. Now let's go back to our guideline. When the surgeon operates in two capacity, the surgeon and the radiologist, that surgeon is not operating in the capacity of a professional component, a professional component of that procedure. No, the doctor is operating as the surgeon and the radiologist. And if that is the case, this is how you code it. All right? So we know 47000 is the code for the liver biopsy percutaneous, and all of the answers share that. But what really makes these codes distinct is A is missing the image guidance, B is coding with no modifiers, C is coding with a modifier on the surgery code, and D is coding for a 26 modifier on the imaging code. Well, let's go ahead and read this parenthetical guideline that's underneath the code. It says if image guidance is performed, go ahead and see 76942. So you're supposed to code the image guidance in addition to this surgery. So we've knocked that out. And we also knocked out, I don't have any on click, so I'm going to just write on my screen. So bear with me. So we're going to get rid of A. Gotta go. All right. Next. Next, let's look at C because C and D are using these modifiers. And what do you do? Well, let's go ahead and read the code. This is the code for ultrasound guidance for needle placement. Example, biopsy, aspiration, injection, localization device, etc. Okay, coders, so this is where the guidance, this is what you have to know. When a doctor is working in the capacity of a radiologist and they're carrying out a procedure like this case, so they need that image guidance to carry out the biopsy. When that is the case, they are not the professional component of that procedure. They are entitled to the full code. So you do not append any modifiers, you just code it straight out. So knowing that guidance enables you to know that C is wrong. C is wrong because they appended a 26 modifier on a surgery code, and that is wrong, right? You can't be a professional component of a surgical procedure. That's wrong. And D is wrong because the doctor is not the professional component. This is suggesting that the doctor just read the films, right? Read and reported. But this doctor actually carried out, he performed the needle biopsy using the liver ultrasound guidance. So, coders, if you said B, way to go. So, radiological supervision and interpretation is simple. If the imaging is used by the surgeon to perform a procedure, a code for both the surgery and imaging is required, but do not append modifier 26. And that's it. That's radiological supervision and interpretation.